Are common cystoscopy myths true or false? Cystoscopy is a key tool in diagnosing and managing bladder issues, including bladder cancer. But many myths and misconceptions about this procedure can cause unnecessary worry. Let's clear up some of the most common claims and see what the facts really are. First, many people believe cystoscopy is extremely painful. That's false. Most patients do not experience significant pain during the procedure. It's usually performed with local anesthesia to numb the urethra, which helps reduce discomfort. You might feel some pressure or a sensation of needing to urinate as the bladder fills, but these feelings are temporary. Serious pain is not typical. If you do feel pain, tell your doctor so adjustments can be made. Another myth is that cystoscopy requires general anesthesia and a long recovery. That's also false. In most cases, cystoscopy is done in an outpatient setting with only local anesthesia. The procedure takes about 15 to 30 minutes. Afterward, most people can go back to their normal activities the same day. Only if sedation is used might recovery be slightly longer, but that's not common. Some think cystoscopy often causes serious infections. While infection is a possible complication, it's quite rare. Less than 5% of patients develop a urinary tract infection afterward. When infections do happen, they usually respond well to antibiotics. Factors like age, smoking, or poor nutrition can increase risk, but most patients do not experience infections. Many believe cystoscopy cannot effectively diagnose bladder cancer. That's false. Cystoscopy is actually the gold standard for diagnosing bladder cancer. It allows doctors to see inside the bladder directly and take tissue samples for biopsy. Studies show that cystoscopic impressions align very closely with pathology results, making it a reliable method for detecting cancer and distinguishing benign from malignant lesions. Some think cystoscopy is only for diagnosis and cannot be used for treatment. That's incorrect. Besides examining the bladder, urologists can perform treatments during cystoscopy. They can remove small tumors, place stents, or treat other bladder conditions right through the cystoscope. This combination of diagnosis and treatment makes cystoscopy very versatile. There's also a misconception that cystoscopy findings are unreliable in patients with recurrent urinary tract infections. Actually, cystoscopy can reveal abnormalities in many cases. Research shows that between 8 and 21.5% of women with recurrent infections have significant issues found during cystoscopy. Visualizing the bladder directly helps identify causes that other tests might miss. Some believe you need to fast before a cystoscopy. That's false. There's no need to skip meals or drinks. The only preparation is to empty your bladder before the procedure. This makes cystoscopy more convenient compared to procedures requiring anesthesia, where fasting might be necessary. Finally, many worry that cystoscopy causes permanent damage to the bladder. That's not true. While some temporary side effects like mild discomfort or burning when urinating can occur, serious or permanent damage is very rare. The instruments used are designed to be gentle, and complications like bladder rupture are extremely uncommon. In summary, cystoscopy is a safe, effective, and often essential procedure for bladder health and cancer detection. The myths surrounding it tend to come from outdated or misunderstood information. If your doctor recommends a cystoscopy, discussing your concerns openly can help you understand what to expect. Remember, this procedure provides direct visualization and tissue sampling, making it a cornerstone of accurate diagnosis and treatment planning. Always consult your healthcare provider for personalized advice and guidance.